Despite progress made globally and nationally in the fight against non-communicable diseases, millions, especially in low and middle-income countries, still lack affordable access to essential treatment and care. This is largely due to high costs of NCD medicines disproportionately affecting vulnerable communities. He acknowledged the challenges but affirmed Uganda's ongoing efforts to scale up prevention and treatment measures nationwide.
As a country, definitely we did the investment case for NCDs, and I think it's just one of our advocacy tools. We need to be able to do that. So we need to be able that when we talk of physical increase in physical space, domestic resources, we should also be looking at if it happens for health sector, then some of it should trickle into the NCD budget. The NCD, the value they're generating this data, and we can make improvement. We need to be able to look at all this.
With PATH Uganda serving as the secretariat, the coalition, which is the first ever global coalition meeting outside the United States, brings together healthy sector players committed to improving access and affordability.
Coalition for Access to NCD Medicines and Products is a global group of partners, countries that are really focusing on increasing access to NCD medicines and products. The coalition has been in existence for the last 8 years, and today marks the very first meeting for the coalition sitting outside of the US.
Dr. Jared Mutunji, head of the NCD division at the Ministry of Health, emphasized the growing threat posed by lifestyle diseases, revealing worrying statistics and urging Ugandans to embrace healthier living habits.
Unfortunately, we are not doing well. When we first did our study in 2014, diabetes, the prevalence of diabetes was 1.3. When we repeated in 2023, or 9 years later, it has almost doubled to 2.7%. So we are not doing well because Ugandans are changing lifestyle to poorer living standards, eating poorer.
Representatives from across Africa, including Kenya, Tanzania, Senegal, Somalia, and the DRC, joined Uganda in pushing for stronger continental collaboration. Dr. Kimberly Green advised that multinational negotiations with pharmaceutical manufacturers could help drive down NCD medicine prices through insurance schemes and domestic financing.
Countries being at different places with national health insurance, and making sure that in the benefits package, NCDs are covered and that the medicines that are required to treat NCDs are part of that package.
Access to, like I said, drugs is very limited.
They have normative functions, and before you think about access, you must have the framework within which to operate.
As Uganda steps forward to lead global conversation on NCDs, the call is loud and clear. Collaboration, innovation, and domestic commitment are key to improving lives across Africa and beyond. Irene Faith Nantongo, Chris Buyondo, UBC News.